welcome to the webinar. This is going to be a wonderful webinar, and it's regarding Exomind, and we have different doctors, of course, that will show us how it fits into your business, the history of it, and how applicable it is. So this is a whole new age of medicine. So we're going to have 4 different speakers. There's myself, of course, that sort of will do moderator also. Dr. Michelle Dees is a psychiatrist in the United States, and she'll be talking a little bit about the history also, which I will also, and her experience with Exomind. So that's really thrilling to look forward to. Dr. Reha is joining us from Turkey. He's a plastic surgeon, and he will look at a growth avenue regarding Exomind in the clinics. And my good friend Ali will be giving us a lecture on how to enhance mental wellness. So the whole new approach to aesthetic medicine, of course, is a holistic approach that you just don't look well on the outside, but you have to look well on the inside as well. So this is myself and my contribution. We are ourselves getting up and running on Exomind, and I'll be looking at 2 different things: the importance of mental wellness in aesthetic medicine, and also I'm going to take a little brief look at the history. The history is fascinating, by the way. You know, we've been using, it's hard to believe, electricity to the brain 2,500 years BC, believe it or not. That's 4,000 years ago. And I'll go into how that was. So why are we interested in mental wellness? 50% of aesthetic patients are found to have problems with mental wellness. And it surprises me, the statistics, we'll look at them in a moment, that the UK is, and I'm sure Ireland as well, is as high as 74%. And interesting, countries like China are only 14%. So we can transform appearance of patients, obviously cosmetically, but how do the patients feel inside? So even though we get perfect results in patient satisfaction, often people who carry problems into the clinic regarding financial problems, stress at home and all the rest, that inner tension remains unsolved until now. So now we can do something about it. Now, mental wellness is the #1 health concern, which really surprised me. It's above cancer, obesity, and even coronavirus. So we're living in a stressed out world at the moment where people aren't sleeping properly, have high cortisol levels, and as a consequence, for the first time now within an aesthetic clinic, we can begin to treat this also. This is what I mentioned earlier. 74% of the UK population feels so stressed that they're unable to cope with it. And that comes from a magazine, the Mental Health Foundation, in May 2018. So it may even be higher now, because 2018 was before the COVID virus hit. 62% of the world's population have problems with insomnia. And almost 500 million people, or over 500 million people, have a diagnosis of depression or anxiety. And this is the one that I was talking about earlier. Shocks me that the UK and the US is so high and China is quite low. I'm sure Ireland is pretty much the same as the UK. And in terms of mental wellness to aesthetics, of course, high cortisol levels will cause collagen breakdown, delayed healing. Poor sleep will cause premature aging, because we know at nighttime, this is where the repair mechanisms, particularly regarding collagen 1 and 3, take place. And what I'm going to look at now is the history of influence in the brain from devices. So I'll go through this quickly, and Dr. Michelle will be doing this also, so I'll not want to step on Michelle's toes, and I'll try and keep it more electric rather than magnetic. So as I said earlier, we had a situation where early use of devices with headaches particularly, and some neuromuscular disorders. Hippocrates, in many ways, tried to apply most medicine through the 4 humors: blood, phlegm, bile, and black bile. I didn't really agree with Hippocrates actually being in charge, because a lot of these old theories went all the way forward to, particularly we've seen it in Spain. You had on one side the Western Christian armies, I suppose, dealing with patients by doing bloodletting, and these are people who are dying on the battlefields, whereas a lot of the Islamic armies had plaster Paris, they could do surgery. All those things were carried from Constantinople across. Galvani, of course, was the first one to introduce the fact that electricity exists, discovered first in animals, but later in humans, and they called it animal electricity. And this is with frogs' legs. So him and his brother wrote some interesting sort of papers. As a consequence, they had introduced, particularly with this paper, the fact that we have got electricity going through the body. Kraepelin was introduced from the point of view of trying to take this all scientifically. The church tried to convince people that they were sinners, so he worked out the difference between, at the time, bipolar disease and schizophrenia. And as a consequence, he took it out of the sense that people were failing morally to that biochemistry was involved. In terms of the early sort of works, we had a situation particularly where, believe it or not, these electrical stimuli were from galvanic packs. And people used to go around the United States and apply these to people's heads. And the introduction of things like brain fog, insomnia, they used to go from village to village, attach these to people's heads. So the whole use of electricity to treat these disorders goes back quite a while. 150 years almost. This was an interesting doctor in France, and he applied magnets to people's heads, and they seen flashes in the brain. So as a consequence, they knew that for the first time you could induce electromagnetic stimuli within the brain that created flashes. So as a consequence, they realized that vision was perception. But the most interesting thing of this is the fact that you didn't have to attach electrodes anymore. You could use a non-contact method that actually created flashes within people's brains. So they knew they could get some electrical activity in the brain without actually having to implant any electrodes at all, which is really the forerunner of what we're doing with TMS or with Exomind. So this particular magnetic field here, they used ones then at right angles to each other. They used ones with higher currents. We then had a situation where Cerletti and Bini used for the first time ECT. So this came from common sense, from the point of view that they knew that people, after they had epilepsy, it cleared the brain and often reduced depression. So they tried to create a situation where they could cause an epileptic fit from the outside in the brain. And they did that quite successfully. And believe it or not, one of the first uses of it was a man who was found delusional on a train. And after they treated him for 2 or 3 times, his delusions had disappeared. So then they tried it for schizophrenia. And don't forget that this was an era, just before the First World War, when a lot of people still thought that things like schizophrenia were devils in people's minds. So once we were able to keep the church's attitude out of it, if you know what I mean, so the science came into it, then a lot of these problems, including depression, were discovered to be biochemical. And we know that because a lot of the early pharmaceuticals, particularly for blood pressure, created depression. So that's why serotonin and dopamine were discovered. These were the early neuromodulation pioneers, and Joseph Jose de Lacio was a very interesting one. De Lacio was able to use this to actually stop a bull charging towards people. So then we had again the introduction of people, particularly from the church again, trying to say this is affecting free will, this shouldn't be allowed. And as a consequence, the use of this came more into science per se. This is Lacio's book, Physical Control of the Human Mind, and he wrote that book in 1969. Anthony Barker wrote a paper. Barker had written a letter to the Lancet at the time. So these really are the pre-runners of the devices we're looking at the moment. Anthony was the first person to use, I suppose, transcranial magnetic stimulation. And that letter was back in the 1985. He sort of had introduced it here, and it's coils. And this was his introduction to the Lancet in 1985. And these are the different devices per se. And in 1986, the coils that he was using had some effect, but they made them smaller, they made them more focal, and different ones like Neurostar had come out. This is obviously the BTL Exomind, and as a consequence, our colleagues now, Ali will next give us his results on using it. So that's like a brief run through of the history of it. And in terms of Exomind, we want to create a situation where Exomind will be in aesthetic clinics, providing the holistic approach to our cosmetic effect per se. So our next speaker is a good friend, Professor Alec Gannon. He has clinics in London and throughout different parts internationally. So Ali's going to fill us in more on the results that he has got within his clinic.
Thank you very much, Patrick. This is a great introduction, and I really am fascinated with the history of this physics and brain interaction. I cannot agree more than mental health is one of the most important problems that are facing us in modern history, and probably also across human history. And in fact, I always believe, and I teach to my students that it is aesthetic surgery is actually a misnomer. The real name for aesthetic medicine and aesthetic surgery should be psychological medicine and psychological surgery, because in a way, if we are to imply beauty as a synonym to aesthetics, we are not actually making our patients more beautiful. You know, many of our patients come and they are stunning, and I don't think they leave me more beautiful. And in the same time, you know, when they come to us, we are not implying that they are not attractive or not beautiful. However, there is something in their mind that asking them to come and see us, because that thing is holding them back in life, is preventing them from being the best version of themselves. Their relationship of an aspect of their appearance, and it is the emotional and the psychological dimension of that relationship that make them come and visit us. So even if we successfully address that aspect in some patients, I think, you know, without understanding the importance of psychological and emotional well-being, we will be missing the target. So how, and that's why really when Exomind was born, I was extremely interested in it, because I've been thinking about patient psychology and satisfaction, and that's what is really the driver of my personal development. And here I have a chance to directly enhance the mental wellness with Exomind. So I'm a plastic surgeon, I'm a professor of aesthetic medicine. I've taught and trained across the world, and we are very proud that our clinic was chosen as the best clinic in London and the UK in last year's aesthetic awards. So we really strive in order to provide a patient-centered service that is comprehensive and holistic and 360. So here we really are in an era where medicine is moving away from the Hippocratic era of like having a problem and then trying to solve it, into really trying to optimize our life so that we never have the problem, we never have to face disease. For example, we are all more aware now about how our relationship with food, for example, have a huge impact on our well-being and health, not only physical, but also emotional. The majority of the serotonin receptors in the body are in the gut. That's the hormone of happiness. So really, we have a very important role here as aesthetic practitioners and healthcare professionals to understand the mind and the wellness in our patients' population, and try to intervene in order to optimize it, whether indirectly through what we do to enhance their face or body appearance, or directly, as now we are able to do with ExoMind. So what ExoMind is offering us is a way of supporting our patients through their emotional well-being, better emotional stability, resilience and adaptability to change, eliminating of the brain fog and allowing a more lucid mind and better decision making, better control of impulsivity and self-control, better motivation. It will allow us to reduce stress, improve the mood, maintaining positive relationship, at work or at home, and that enhancing their social and psychological well-being in a more purposeful way, in a calm and a serene way. I mean, if you can reflect on these important things, you can probably agree with me that this is an amazing aspiration for all of us to move towards. So is this a science fiction that we are facing, or is this a real ready to implement in the clinic reality now? I would really tell you that for me, I started with a very skeptical attitude towards this, even though I'm very excited, because I felt that, like we are not ready yet to embrace direct intervention with our mind through the brain electromagnetic stimulation. However, reviewing the studies that has been already published in this field, there are several ones in the psychiatric domain, and we will listen to an esteemed colleague from us in this regard. But the ones that I reviewed in relation of the mental well-being, and especially with food issues, as you know now, we have a global problem with obesity. We have all these controversies around surgery to reduce the body ability to absorb food, or now GLP antagonist drugs like the Mounjaro and Saxenda and Ozempic. So it is really a huge burden for health. So for example, this mental well-being study conducted on 33 patients with 4 sessions only. In our protocol, we have really a subscription model that take the patients with several sessions beyond 4, separated with a 1 week apart. We have a very significant improvement in the mental and well-being scale, whereby the patients reported 88% improved in mental well-being, 81% feeling better in their mood, sleeping improvement in 78%, energy improvement in more than 3/4 of the patient, more confidence in almost 70% of the patient, problem solving and stress management and handling improvement in 70% of the patient, quality of the sleep also in 70% of the patient, and less gloomy in 66% of the patient. That is an American study that we tried to actually reproduce in my attempt to objectively verify. So our exact European experience showed that actually our patients improved in a similar way, or even better than our American colleagues, showing a better overall mental well-being, a standardized assessment score improvement in 94% of the patient, better energy in 100% of the patient, better focus and reduction of brain fog in 87% of the patient, happier, better mood in 94% of the patient, less anxious in 100% of the patient describing, more zen feeling after the session that lasts for, several days, and improved quality of sleep in 87% of the patient. Also, we have another study by colleagues from United States reporting improved in willpower and self-control with 51 patients. 90% of them found the therapy to be comfortable without any adverse effect, and these reporting really improved self-control and the reduction of impulsivity, especially in relation of the food at the end of the first month, and an improved patient-reported outcome measure with the BSC scores compared to sham, 3-fold improvement compared to sham in a similar way with the FCQT score, 2.5 times better compared to sham studies. Another paper looked at the stress level and reporting on 34 patients. Again, 100% reported absolutely no adverse effect. 85% reported decrease in stress level across the 4 treatment. 92% felt more relaxed, and 77% found it easier to sleep and an improved sleep following the treatment. In relation of carving of food and relationship of food, there was actually an objective reduction of the patient weight of 2.3 kilogram without any change in their diet or exercise at the end of the treatment period, which is around around similar or slightly less than what we would expect for somebody going on a injection treatment with GLP. So 92% of the patient reported the therapy to be really comfortable. 87% felt improved self-control, overeating and impulsive comfort eating, and 74% achieved complete recovery of this binge feeling. Again, we reported the same tools, and we try to reproduce this outcome in our patients. We had 100% improvement in the food craving scale on the FCQT, 97% better control over their eating habit, and 97% felt comfortable during the therapy without adverse effect. We had here a professor of psychiatry as one of these 15 patients, kind of confirming, and I think I really take her testimony very highly, that this is a real transformation of her own mental well-being. She has been suffering from, impulsive eating and comfort eating throughout her life, and she was really very, very happy about the changes that she experienced in this regard. So how do we offer it in our practice? Initially, we started with offering packages of 4 to 6 sessions, but now actually I feel that this is a continuous journey for the mind. It's like going to the gym for the mind, and we are offering it on a subscription model for those patients who really feel that they will benefit from it. It is difficult initially to have this conversation with patients who are a little bit skeptical about having electromagnetic stimulation through the brain, but by emphasizing on a holistic 360 approach, and as we engage with longevity of the skin, we also talk about longevity of the gut and longevity of the brain, and we offer them this, and we usually give them 1 or 2 sessions complementary initially to feel the advantage on their emotional and psychological well-being. So in conclusion, I think every practice will benefit and every patient will benefit from this little help that modern life stresses and pressures will bring at us. So, and I think Exomind represent a paradigm shift in our ability to use this technology rather than, having it only available in highly specialized psychiatric hospitals and units that might be quite frightening and, worrying for the average, patient or the average human being who doesn't have severe mental health issue to consider going and seeking help from. Thank you very much for your attention.
Ali, thank you very much indeed. What wonderful results regarding binge eating, and it's great to see that, particularly in our practice, from the point of view that we use so much of the Ozempic, Mounjaro, and particularly also in terms of any of the devices in terms of losing weight, we can use it, in association as an adjunct method. And we find that as well. We have a weight loss clinic, and as a consequence, we put the people on Exomind as well, and one works really well with the other. Particularly the price of some of the new, I suppose, GPLs in terms of injection. So our next speaker is Dr. Michelle Dees from the United States, and she is a well-known psychiatrist, and she has been up, I suppose, using Exomind now for the last 2 years. She has more experience than any of us to an extent. So, Michelle, thank you very much for being with us today, and I'm looking forward to your session.
Thank you. I loved the talks that the team has brought so far. I think this is going to be a great discussion. So basically what my goal or objective of my part of the presentation is, basically we're going to talk about my mental wellness study that we did in the United States in the Orlando office. I'm just looking at Exomind and how patients improve. I am going to start that we were featured in Vogue magazine, which was pretty nice because it focused on how it's also going to be helping with that perimenopausal woman.
It's often hard for patients to find resources as far as mental well-being. When you look at antidepressants, you see side effects. If you propose ketamine, there's disassociation and side effects as well, including not being able to drive. Patients are often unable to find a therapist because of a lack of resources. Sometimes patients become frustrated because exercise and natural remedies helps, but it doesn't get to the root of the unbalanced neurochemicals in the brain. A lot of times people just want to have a treatment that is not medication-based, but rather an effective science-based treatment that will actually help the brain structures grow, build more pathways, and balance your hormones naturally. When identifying patients in your practice, screening tools can be used, conversations can be had, asking patients, how is your day? What is going on? How is your family? How is your friends? Talk to them, get to know your patient, see how they're feeling on a day-to-day basis, see if there's any room for improvement, or is there any way that we can help with their overall mental well-being. TMS technology has been around and FDA cleared since 2008. There's over 17,000 published medical papers on TMS and the safety and effectiveness of the treatment. One of the challenges is that we just need to have conversations with our patients, making sure that they're aware there are treatment options that does not have side effects that can help patients for any kind of problems with their mental health.
And this, again, just kind of talks about the evolution with TMS over the last 40 years and the innovations that have happened as far as different technologies. And I can kind of go over how Exomind doesn't have a huge footprint in the room. It's, easy to navigate. It goes room to room. It doesn't require special setups like some of the other brands do.
When you ask patients, how do they feel during Exomind, patients report that they're relaxed. They feel like clarity has been lifted. They're sleeping better. They have less brain fog. They have less worry. They have more motivation. They are getting along better at work with colleagues. They're getting better with their family and friends and their marriages. So Exomind can be truly helpful when it changes patients' life, both personally and professionally.
The unique features of the coil, how quiet it is, how comfortable it is for the patients to feel. Either it's an 18-minute and 45-second treatment or a 24-minute treatment. So super not time committing for patients, and how you can experience, early achievement.
With older technology, you can see the pulse of the magnet is more of a sharp up and down motion. With Exomind, they have a trapezoid type delivery, which allows the patient to have a quick and comfortable treatment. With the Select 2 and the Select 1 models on the machine is also very customizable too to help patients get balanced as far as their treatment needs.
So looking at the brain, frontal lobe, and why it's important that we're targeting the dorsolateral prefrontal cortex. It's involved in the decision-making, neuron pathway, short-term memory, basically just emotional health overall. Again, the TMS is we are treating the left side, so the left dorsolateral prefrontal cortex. The right side is associated with, spontaneous responses, impulsive behavior, negative symptoms, and how the TMS stimulates the neurons, extending neuron connection, causing those bridges and those brain pathways to form, therefore having the transmitters more balanced. And then once those transmitters are more balanced, patients are going to have improvement of focus, energy, concentration, lassitude. They'll start showing more interest in things that would normally give them pleasure. They'll be less depressed, less worried, less sad. And how Exomind works and what do we treat?
The TMS technology of Exomind is brilliant. The magnet itself will stimulate the left dorsolateral prefrontal cortex. This releases a protein in the brain called BDNF. This BDNF will help the neurons grow and build new neural connections in the brain, allowing serotonin, dopamine, and norepinephrine to be more balanced naturally. So just like we go to the gym and do health with exercise to build muscle, we're actually causing brain health, which is an exciting journey to be a part of when a patient comes to you looking for alternatives for overall mental health.
Causing the increase of neurotransmitters to be released in between the cells. So we're trying to make, naturally more balanced instead of doing it chemically with side effects. Exomind therapy enhances the dorsolateral prefrontal cortex. It's going to help patients with overall mental being, mood, stress, energy levels, concentrations, basically all the DSM-5 criteria for major depressive disorder. Benefit also is self-perception, which hits hard with the audience with plastics and med spas. So if you don't feel good on the inside, you're not going to feel good on the outside. I mean, it can help sometimes with that, that food noise of wanting to eat late at night, that type of stuff. And that pretty much wraps up my point.
Before I let Reha talk, hi, welcome from Turkey. We have a situation, I suppose, where with the new device that we are using for 2 or 3 different reasons. One of them is for anxiety, insomnia, brain fog, and we certainly have a lot of that since COVID. And this is the first device that has been taken from a psychiatric background and we can use in our clinics. And so far we're getting such wonderful results. And the second thing, of course, is what Professor Ali adhered to, and that is the fact it can be used also for behavior control, particularly in terms of people who have binge eating that we would have had on GLP-1 injections that they may have to stay on for the rest of their life. But if we use an adjunct like this really fits into our clinics. So
100%. So you're exactly right. So when you're using that with the GLP-1, that's a great alternative, because then you're not having the side effects or the needle burden of the GLP-1s. It's a perfect place within the practice of somebody wanting, again, more natural, more holistic. It's a great choice.
Absolutely. And then, of course, in terms of depression or mild depression per se, we've got a situation where GPs may be putting people on SSRIs, and hopefully we'll be able to fit into that market, that our patients are coming to us telling us their different problems, and as a consequence, before they get a treatment, we can align with this Exomind device, and they may be able to treat a lot of their depressive or anxiety symptoms non-pharmacologically. So we're really looking forward to a whole new era of medicine. We're going to have mental wellness, longevity, and aesthetics all together. So
it's a very exciting time, because lots of patients don't want to take antidepressants. And so if you can remove that pill burden from the patient, they're going to feel great. They're going to feel like, I'm not sick. I don't have to take a medicine every day. I've actually exercised my brain. I have clarity. I feel good about myself inside.
Absolutely. And for those that are watching also, because we haven't really approached it per se, there are some patients we wouldn't treat. Obviously, people who have got epilepsy, people
Right.
who are on certain treatments like ADHD and that, because it confuses, I suppose, the prefrontal cortex to an extent with the motor activity. Even people who maybe have taken a lot of coffee that morning, I noticed that it's better probably bringing them back later in the afternoon to treat them. And we have a situation, I suppose, also where people who have got certain conditions that are psychiatric, we leave that to our psychiatric colleagues. So we're on the more brain fog, mild depression, and of course, anxiety and that. So Ria, it's your turn. You're going to tell us how to integrate it into your practice from the business model. And of course, a lot of the people watching would want to know that per se.
Prof. Patrick, thank you very much. Thank you, BTL, for having me on this great panel, because this is such a great panel of people, profs, doctors, who are really into the science of the brain. So who am I? I'm a plastic surgeon. So why the heck I'm in this group? Well, this is a kind of a energy-based neuromodulator. And when you say neuromodulator, we know that there's a very famous neuromodulator within the needle, which is botulinum toxin, which many specialties are using. My neurologist friend is using for migraine. My physical therapy rehabilitation specialist use for spasticity. Maybe dermatologist is using for hyperhidrosis. And as a plastic surgeon, use for the wrinkles. So it's not uncommon to have a device or medication to be used with multi-speciality. Of course, people need to find and know their limits, which I definitely do. And I highly respect that, I'm not treating any psychiatric disorder. So, this Exomind is kind of bringing a new avenue to the aesthetic clinics. Why? Because when I talk with, my colleagues, when I talk and make meetings with my staff members, what I tell them is, you know what? We don't treat wrinkles. We don't just lift up the faces. We give joy. We give happiness. We give fun to our patients, because that is what they are exactly seeking for. That's why in their life, when you talk with them, like meditation, going back to their own origin, living in natural environment, or doing things that will make them happy, becomes more and more prominent in their life. So in our clinic, we have many things to offer, as these three lines, which is the primary care physicians, the med spas health centers, and more professional side on the psychiatric problems, as well as the aesthetic medicine centers, are places that can use the Exomind. Of course, as I said before, we all need to find our limits and respect to the core specialties. Do we really need this? Yes, we do. Because when I look at my own patients, let's say the patient walks in for a breast augmentation or a facelift or a simple Botox injection or a filler injection, at least 50% of them have some sort of a mood alteration. Not necessarily I can diagnose them like a psychiatric disorder, but around the globe, at least half of the world, they are not very happy. We are not very happy regarding maybe our life, maybe our body shape, maybe about the country or the world that we are living in. So is there something we can do it so that, that will bring in more energy to cope with our problems, whether that's, for a female OBGYN problem or a male who has stress at the business, which has an impact on the weight management. So that was my motivation to start with the Exomind roughly about 10 months ago. So we have an experience of 10 months in an aesthetic clinic in Istanbul with the patients that we have been using and recommending. Well, females seems to be depressed more than males. Well, I can really argue that, especially if you're in the business, we always have issues and challenges that we are coming into us. So genderlessly, mental wellness, if you have something, please, let me use it, whether that's meditation or breath exercise or ExoMind. Well, all these are not really fitting into the same category though, because when you look at the ExoMind, now we are looking at a high-tech device, which we just heard about its dynamics and roots, which has FDA approval. So now that makes me more happy and feeling as if I'm a physician trying to do something to improve the mental wellness of our patients. Well, you have seen similar slides. So what it does is, if you look at the figures, everything is above 75 to 69, percentage. The confidence, energy, the stress management, the uplifted mood, these are all things that we always discuss when it comes to the aesthetic medicine. We always talk about how you feel confident with your skin tightening or with your, less wrinkled face. This is applying to the ExoMind as well, because sometimes we do one of the best rhinoplasties or breast surgeries, or the face looks amazing, but the patient is not as happy as I would like to see. Not necessarily this patient is a psychiatric patient or a significantly or severely depressed patient, but we need mood uplifting. That is why from time to time we go to the next door pub, right, for a glass of wine maybe. Well, we do know that right now that is not the best way for mood uplifting. What about ExoMind? What about replacing ExoMind to uplift our mood, whatever we are doing? And then it might be much easier to replace certain things that might have side effects, such as the GLP, that we were just talking. So I see not an opportunity, I see a very nice potential in this to provide a more holistic approach and treatment modality to my patients. Because when I say opportunity, it sounds more business, but my excitement is not coming from its financial potential benefits to the clinic, but to really providing a holistic, fully, coverage to my patients. So, look at this. This is the aesthetic market. If we want to talk about the business side, which is already a very big figure, and this figure is growing almost double digit every year. But what about the mental health? Again, respecting to the real professions of that area. I can't underline or highlight more. Everybody needs to find their position and respect to the specialties. But this. It's not surprising that many of our patients are taking a lot of antidepressant medication, and mostly some of them are, not very well controlled or followed up. Do they really need this? Is there any way that I can save some of those patients out of that medication? So this is kind of a neuromodulation, so that the behavioral health, the mental wellness, going to be taken to the next stage without much of a problem or potential side effects. As Dr. Patrick said, there are tons of studies out there, and we saw that. And around the globe, the society also has a increasing interest in this, as it looks like a science fiction device, although the roots were back in several years back. Well, there are news out there. There are certain, interesting magazine or social media ads coming out, which increases the brand awareness, which increases the treatment awareness. And I do know that there are also potentially other brands that will be coming into the market as well. Yet ExoMind, with its fine coil that has been explained and providing a very precise treatment, seems to be a very safe option. So how do we find the ideal patient? How we are going to communicate with our patients? That is a challenge, and every single clinic needs to find its way. In our clinic, as we have a longevity line, we use vibroacoustic treatment, we use intermittent oxygen therapy, we use ozone therapy, we use, mental health related products. it was very easy for us to incorporate the Exomind to our clinic. And again, it was difficult to describe or trust, but give it a try and have your first initial treatment and see how you're going to feel and what you're going to feel. And that is exactly what is happening with the patients. Therefore, you know, the retention rate of the treatment seems to be significantly high. So, you know, we have a neuromodulator, an energy-based device neuromodulator, and I think a lot of different specialties can benefit from this device. And I would like to say thank you at this point for the chance to quickly give my own experience in our clinic, which is focusing more on aesthetic and longevity. Thank you very much. Patrick, back to you.
Thank you indeed, Reza. That was wonderful. So just to sum up where we are to date, we've got a new device, as we said, that can reduce anxiety and other related conditions. We can use it for OCD, as Ali showed to an extent, binge disorder eating also. So any excessive eating disorders, and binge eating, food cravings, addiction per se. And it's interesting the way that this almost mimics a bit like the GLPs also can reduce, for instance, a compulsive behavior, particularly towards alcohol, up to 76% per se. We said that it enhances cognitive function, of course, and focus. And a lot of people, particularly sports people, and we're in a gym, so it's really good for us from that point of view. They say that it boosts clarity and as a consequence, motivation, energy. People sleep better, and that's really important as well. It's working this, of course, by enhancing neuroplasticity within the brain, and that is enhancing the brain's ability to form new, I suppose, healthier connections between the different sort of synapses, neurons, and neurotransmitters. So this is particularly for long-term resilience and well-being to an extent. We said also this got FDA approval for depression, and we've been using it for mild depression. We were at a interesting Exomind launch with some psychiatrists a few days ago, and they're trying it also, of course, in things like preventing Alzheimer's and maybe even Parkinson's disease per se. I wouldn't advocate that as a frontline therapy in the clinics, but most of the electrical or electromagnetic devices towards the brains certainly have an effect on that. And we know that from this deep brain stimulation for Parkinson's disease, where it affects the basal ganglia and the thalamus, of course, with implanted electrodes. And the interesting thing is now that within a few years, we will be using, within 2 years, I reckon, ultrasound instead of deep brain implants. They've already almost perfected the ultrasound hats that they're using for this. So I know this quite well because the Nuffield in London beside Great Ormond, I've been in a couple of the deep brain stimulating units and know some patients that I sort of went to see there. And then, of course, also it's drug-free. So as a consequence for the different depressive disorders, hopefully we'll be in a situation where we'll not be able to use SSRIs. So we've had all the speakers now. So let's take a look and see whether there's any questions coming in per se. Ali, what do you find is your biggest use of the Exomind? Is it because of your association with obesity and treating patients in that direction, or do you also use it for cognitive function?
Definitely, initially it was to support our obesity clinic and obesity management. I struggled with my own weight for all my adult life, and really it takes a lot of discipline and strength training and dieting in order to try and avoid those who have maybe insulin resistance, like probably I do.
You must be doing something well, because you don't look very overweight to me.
No, I am like 9 kilos lighter than January 13th, 2024. So it has been a very, very strong, kind of like work in going to the gym, changing my diet, cutting carbs, and also intermittently GLP. So for me, I feel for those people who are normal weight, but they are doing a lot of work in order to keep that weight off, or those who have actually managed to keep, to put few weights on, and then they want to lose it, and it's not easy. So for me, that was the introductory hook for me to get engaged with this in relation of the impulsive eating and, binge eating and the relationship with food in general. However, as as we heard from Reha, his 360 approach of well-being and, like the increased demand of our patients to look after their longevity and general health, put us in a position where we have to discuss mind and cognitive function. And with that, we have now this part of our longevity program.
Thank you very much indeed for that. One of the questions from Argentina is the treatment done in conjunction with a psychiatrist, or is it done alone? I think probably you can use it as a dual modality per se. Some patients certainly will need psychiatrists rather than psychologists per se, and normally we don't try and take those patients. The patients who would need biochemical help or pharmacological help. What do you think, Reza? Would you use it in association with it? They have asked psychologists rather than psychiatrists.
Well, that really depends on how you position. As I said, I'm not a psychiatrist. I'm not treating a depression. If the patient is really in a depression, I don't think that I should just take him or her and take to the Exomind. That's altogether a different story. So what I perceive or understand is I can uplift your mood, which is going to help with your cravings at the end of the day, which will help with eating habits, weight management, potential alcohol consumption, potential, smoking consumption, tobacco consumption. All these are good stuff. On top of that, as the data shows, there's an increased level of energy, which is difficult to quantify, but this is something that I have been experienced with my own patients. So, and then it comes down to the clinical judgment. You walk in and you're asking for some sort of a treatment that we provide to you. And on the side, we also have the longevity treatments that we are doing. And you don't look very happy. Well, what I'm saying is very subjective. But as we have been in the practice for a long period of time, we gently recommend this treatment. And what I see is a big amount of patients that are going through the Exomind are leaving the treatment session not necessarily happy, but feeling better. Is this a placebo effect? Is this a real effect? Of course, we need more studies. Of course, we need to analyze in more depth. Of course, the functional MRI, and you folks, the real scientists when it comes to the brain, do need to really look into. But from a clinical perspective, what I see is there's a definitely benefit that my patients are getting. That is why I say that, okay, this is an energy-based neuromodulator. Well, I'm using a injectable neuromodulator. Now I'm also using an energy-based neuromodulator. And that's how I try to position.
Well, thank you for that, Reza. One of the questions, hi, do you have any experience of patients with psychogenic ED, erectile dysfunction, or with sexual health in general?
Yeah, that's a great question. So all of the antidepressants that we usually give cause sexual dysfunction, kind of a motivator for patients then to go and bridge to TMS, since antidepressants cause GI side effects, sexual side effects, weight changes. Well, we can offer an alternative to get them into better physical health and along with their mental health. Great success with Exomind. I probably run about 10 Exominds a day in a 7-day-a-week clinic. It's super busy, and the feedback is outstanding. So that's a great question about sexual side effects.
And also this one goes to you as well, Michelle, if it's okay. And it says, do any percentage of the patients go through a TMS dip during the treatment?
It can. People respond at different times. Sometimes people will say that they feel better on the first one. Clinically, what I've noticed is that your sleep gets better first, and then sometimes any kind of depression or anxiety lift towards the end of the series or course treatment, but everybody's very individual and has varying degrees. So that's why some patients may need more treatments, potentially less depending on their symptoms, but that's why we've got a great clinical staff, taking a look at patients on a day-to-day basis just to figure out exactly what is going on with the patient, just to make sure they're getting that goal of getting close to their baseline.
And also, this one goes to you to an extent. And how does it compare to traditional RTMS in terms of strength, durability of effects, and indications for use?
Great question. So Select 1 on Exomind is the traditional MDD protocol. So it's 10 hertz at 18 minutes and 45 seconds. The patients, get the same cycle. That's the FDA-cleared protocol. And then the exciting protocol is Select 2, which is the mental wellness study. It's 6,440 pulses at various hertz cycles throughout the treatment. And also, the machine can be customizable too. So it's a neat way to, kind of compare old traditional stuff that we've known around, 17,000 published papers out there on how safe and effective TMS is. But now we have this whole new entity of mental well-being where we're able to bridge the gap for patients, not only that don't want to see a psychiatrist, but for those who just want to improve on their overall mental well-being.
Thank you, Michelle. And sorry, because you're the one of the speakers who have the most psychiatric experience among us surgeons per se. Again, this is directed at you. Have there been any studies or results with children with autism in terms of Exomind?
No, there's not been any studies done in Exomind. It's actually FDA cleared for ages 22 and up, but I'm sure Exomind, just like all their other technology, is looking into another avenue or patient population so we can get this in front of everybody. So I'm excited to see what the future holds.
Okay. Ali, have you anything else to contribute at the moment?
Yes, I have been actually going through all the questions, which there are many from the audience, and I really thank them all for their questions. And definitely what I see here is like a kind of thirst for evidence-based and hardcore medical indications. And, some people are mentioning, for example, concussion, or like we have very low number of studies in these evaluations, etc. And I really want to just comment here that definitely I never ever imagined that I will be treating a cluster of ex-professional rugby players in my aesthetic clinic. But because I had one of my patients who was like very high in the rugby world, an ex-captain of England, who have so many stories from his colleagues and mates and friends after concussion and after some cognitive decline, after years of trauma. He kind of like received the treatment as for general well-being, and then he told me, like, really, I think many of my kind of like mates will be benefiting from that, and he became like an advocate for that. I don't have a study for this, but I see that I don't need a study to offer something that I have evidence of 40 years in the clinical domain that it is with little harm and with good effect. And I am offering patients an informed decision about that. I'm chatting with them about the evolution of this technology, and then like, I don't think it's in my realm to try to treat people with like autism or refractory compulsive obsessive disorder. We have a psychiatrist that we work and collaborate with in relation of patients with body dysmorphic disorder. Example, severe like dysmorphia is a contraindication of a lot of what we do in aesthetic surgery. However, really, I don't think that we are talking about transforming the clinic into a psychiatric, outpatient or inpatient hospital. We are talking about well-being. We are talking about, an early stage where we are intervening directly in working with the brain as a dermatologist, aesthetic practitioners, plastic surgeons. This is not a territory that we should delve in. We were very upset when dental hygienists and ambulance crews started to inject people with Botox and fillers. It is very important that we stay within our professional domains, and certainly as a aesthetic practitioner who deal with the aging of the skin, of the well-being of the patients, and trying to give them the best outcome possible. This optimized device that have been through FDA for safety, that have been through the optimization from the traditional psychiatric 30 session device to treat the severe depression and mental health, to what Michelle has told us in her practice. She has 10 patients for different indications a day. I think this is an opportunity for me to enhance the patient journey rather than start to go into the details of how do I become a consultant psychiatrist at the age of 50 after 25 years in plastic surgery. So just I really wanted to make that very clear.
Yeah, that's a great point. And patients can't sleep and they can't focus. It's the number one issue complaint that we see, regardless of what's coming in. And the perimenopause, stuff that's out there, that's a hot topic right now. The lady that wakes up at 3 a.m, she's got brain fog, she is anxious, wide awake, ready to start her day. But then when the alarm hits, she has low energy. She feels stressed out, and she's got normal labs because she thinks it's something else. And it's really about her getting back to mental wellness.
Reha, this question is for you, and it says, thank you for your presentation. Have you noticed any side effects or secondary problems in any of your 100 patients? Excuse me.
Prof. Ali really mentioned so well our boundaries. So in that sense, how I use it just for mild stress management, and many of us need that. In that sense, the amount of the sessions that we do and the already existing protocols that we are following, up to now, we have been using over the last 10 months and around, a little bit more than 100 patients that had been finished up their sessions. We haven't seen any side effects. There are a few patients saying that they haven't seen any positive effect either, but there was no one who was claiming that something bad happened. There was a question regarding the sleep. I was trying to assess the sleep with some sleep questionnaires, sleep quality questionnaires, but we failed to figure out some conclusion out of that. So maybe some real sleep studies might need it. But what I see from the patients is, when I gently start a patient with the Exomind treatment, they want to continue with their sessions. And my typical aesthetic patient is a type of patient who is difficult to convince to a treatment, who is difficult to comply with the treatment as well. This is something that we keep talking within our aesthetic medicine all the time. So they don't stay loyal, or they don't stay within the system, with that. Obviously, what they feel makes them continue with this. I don't know how we can quantify this. We need to bring this down to the science, no doubt. But what I see is a new era, a new door is opening up in front of us. So there are so many things to learn about Exomind. Fortunately, the technology is not new, so which is kind of something comforting.
Reha, you did mention that some of the patients don't have an effect per se, which is on the data also. Most of it is 76%. Would you be tempted to go beyond the 70% boundary and push it up? Or maybe have you done that already to see whether there's effects in the non-responders? Because for those that don't know, the machine is set at a 70% break point that we shouldn't go above?
Sure, but we haven't. And we haven't done that on purpose. As I said, I want to respect my limits. I want to be a safe sailor. I'm okay with no result. If it is 5%, 10%, that's all fine. But every single modality that we are using, there are some non-responders or less responders. And in all the other modalities that we are doing, we have complications. What I see up to now is, with no side effects, a certain degree of non-responders, which is totally fine for my practice.
Okay, no doubt about it. So I suppose, seem to have gone through most of the questions. So thanks to everybody.
Thank you very much. Have a nice day, everybody.
Take care. Bye-bye.
Bye.
Bye.